Thus, in short, peptic ulcer, 2 causes, 1 pain, 10 symptoms. You see, ulcer, many people have the idea that ulcer is caused by skipping meals or taking alcohol, smoking, or chronic stress, or maybe coffee or some teas. No, they don't start the ulcer. They only worsen the conditions. But a real ulcer, actually peptic ulcer, happens when the protective layers, we have 2 protective layers of the stomach. We call that the mucus and then the bicarbonate. The mucus layer actually is so important. It prevents acid from getting to the stomach wall. And then we have the second layer, is called the second protector or defender, is called the bicarbonate. The bicarbonate is there as a neutralizer of the acid. In case any acids skip through the mucus, it will neutralize it. But ulcers happen when these 2 defenders are compromised or they're damaged, and they also can emerge or start in the food pipe, anywhere in the food pipe, or in the stomach, or first part of the small intestines, that the duodenum. If you have any ulcer like that in these places, we call that peptic ulcer. So what are the real causes? Listen carefully. Number 1 and most common cause is a bacteria called Helicobacter pylori, famously known as H. pylori. It enters the body through contaminated food, dirty water, or through infected person, maybe saliva, kissing the person. It travels down, reaches the stomach, and burrows into the mucous lining. Once inside, it releases chemical, it's called urease, to neutralize the acid. And then it makes its home there and eats further into the mucus and bicarbonate, these 2 defenders. So the defenders fall and the wall is exposed to acid, which will further cause more damage. So the question is, when it happens, what symptoms can then the person actually see? Before we come to the symptom, let's go to cause number 2. Cause number 2 are the steroids. The steroids or non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, naproxen, they will normally disturb or block the chemicals in the body called prostaglandins. Prostaglandins are the signs or the signals that tell the stomach to produce mucus. This is a defender, and bicarbonates. So if you take painkillers, you block these prostaglandins, and your stomach will be then exposed. Stomach will be exposed to acid, and then ulceration can start, or ulcers can start. So what are the signs? The main sign is a burning pain in the upper belly. It's called the epigastric region. That's the pain in there. You will experience nausea, bloating, feeling of fullness, and then you also experience distension. That is the belly visibly swells due to trapped gas and delayed emptying. Some individuals may lose appetite. They may vomit, and sometimes they may even vomit blood, and this is an emergency. And when they empty their bowels, they may also have dark tarry stools, and this is also an emergency. Some individuals may experience weight loss because they have poor appetite, poor absorption of nutrients, and they gradually lose weight. And because they are losing blood through vomiting and stooling, they may have low iron. So these are the 10 signs. But how would you know if you have gastric ulcer or let's say duodenal ulcer? Because we have 2 key types of these ulcers. Normally when you eat, when you have the pain, or the pain gets worse when you eat, it's gastric ulcer. And when you eat and the pain dies down, or it dies off, that then means that that person has duodenal ulcer. So what are the complications? It's bleeding, hemorrhage, because the ulcer may erode or eat deeper into your stomach wall until it reaches a blood vessel, and then bleeding occurs into the digestive tract. Blood may appear as black tarry stool or may be vomited. Severe bleeding can lead to weakness, dizziness, or collapse and shock. It's a medical emergency. Perforation. The ulcer eats all the way through the stomach and duodenal wall. A hole opens, the stomach contents spill into the abdominal cavity. This will trigger inflammation in the abdomen. It's called peritonitis. And this severe infection is an emergency. It will make the person's belly so stiff, so hard, so rigid, and cause feverish condition. And this will be it's an emergency for a keyhole surgery. Unfortunately, the surgery will cause scarring, just like ulcers will cause scarring. And that's where natural medicine will come in to heal the ulcer and to also get rid of the scars. Obstruction, that is blockage, is another thing, because swelling and scarring from the ulcer narrows the pylorus. The pylorus is the exit point of the stomach where food passes into the duodenum, the first part of the small intestines. So this is called the pyloric stenosis, and that can actually keep food in your stomach for long, and it can cause vomiting and over time weight loss. The last complication is cancer. A long-standing untreated gastric ulcer can slowly turn into stomach cancer, I should say, gastric carcinoma. If you have ulcer, it's something you can reverse, it can be treated. Don't wait for complications to come, for surgery to come. One call away. Any other chronic disease, a call away. If you're calling outside the UK, it's +44 738 464 7300. If you haven't subscribed and you want to support what I'm doing, be part of this mission, be part of history, go to my YouTube channel, put in Dr. James Natural Link, Dr. James Natural Link, and subscribe please, and be part of this mission. Thank you so